Fatty liver, also known as hepatic steatosis, is a condition in which there is an excessive accumulation of fat in the liver cells. This condition is commonly seen in people who drink excessive alcohol, but it can also occur in people who do not drink alcohol, known as non-alcoholic fatty liver disease, NAFLD. NAFLD is often associated with obesity, insulin resistance, and metabolic syndrome. If left untreated, it can progress to non-alcoholic steatohepatitis, NASH, which is a more severe form of liver disease that can lead to liver cirrhosis, liver failure, and liver cancer. In the early stages, fatty liver may not cause any symptoms and can be detected through blood tests or imaging studies. The treatment of fatty liver depends on the underlying cause. If it is due to alcohol consumption, the treatment involves quitting alcohol. If it is due to obesity or metabolic syndrome, lifestyle changes such as weight loss, exercise, and dietary modifications are recommended. In some cases, medications may also be prescribed to improve insulin sensitivity and reduce liver inflammation. Causes of fatty liver. 1. Obesity. Excess body weight is a common cause of fatty liver. This is because the liver can become overwhelmed with the amount of fat being delivered to it from the body's adipose tissues. 2. Insulin resistance. Insulin resistance, a condition in which the body's cells become less responsive to insulin, can lead to increased fat accumulation in the liver. 3. High alcohol consumption. Drinking large amounts of alcohol over time can lead to alcoholic fatty liver disease. The liver becomes unable to process the excess alcohol, causing fat to accumulate in liver cells. 4. Medications. Certain medications, such as corticosteroids and tamoxifen, can cause fatty liver as a side effect. 5. Rapid weight loss. Losing weight too quickly can cause the liver to release stored fat into the bloodstream, which can overload the liver and lead to fatty liver. 6. Genetics. Some people may have an inherited predisposition to developing fatty liver. 7. Other health conditions. Fatty liver can be associated with other health conditions such as type 2 diabetes, metabolic syndrome, high blood pressure, and high cholesterol. It's important to note that some people may have fatty liver without any underlying cause or risk factors. If you suspect that you may have fatty liver, it's important to speak with a healthcare professional to determine the cause and appropriate course of treatment. Symptoms of fatty liver. Some people may experience the following symptoms. 1. Fatigue and weakness. 2. Abdominal discomfort or pain in the upper right portion of the abdomen. 3. Loss of appetite. 4. Weight loss. 5. Jaundice, yellowing of the skin and eyes. 6. Swelling in the legs and ankles. 7. Mental confusion. If you are experiencing any of these symptoms or have concerns about your liver health, it's important to speak with a healthcare professional. They can perform tests to diagnose fatty liver and determine the appropriate course of treatment. Natural treatment for fatty liver. There are several natural ways to help manage and treat fatty liver. These include 1. Lose weight. Losing weight can help reduce the amount of fat in the liver. Even losing a small amount of weight can be beneficial. 2. Exercise regularly. Regular physical activity can help improve insulin sensitivity and reduce the amount of fat stored in the liver. 3. Follow a healthy diet. A diet that is high in fiber, low in saturated fats, and includes plenty of fruits, vegetables, whole grains, and lean protein sources can help improve liver health. 4. Avoid alcohol. Alcohol can worsen fatty liver, so it's important to avoid or limit alcohol consumption. 5. Drink green tea. Drinking green tea may help improve liver function and reduce the amount of fat in the liver. 6. Take supplements. Some supplements, such as vitamin E and omega-3 fatty acids, may be beneficial in reducing inflammation and improving liver health. 7. Manage underlying conditions. Managing conditions such as diabetes, high cholesterol, and high blood pressure can help improve liver health. It's important to note that while natural treatments may be helpful in managing fatty liver, they should not be used as a substitute for medical treatment. Foods to avoid. If you have fatty liver, there are some foods you should avoid or limit in your diet, as they can worsen the condition. 1. Alcohol. Alcohol can cause inflammation and damage to the liver, so it's important to avoid or limit alcohol consumption if you have fatty liver. 2. Saturated fats. Saturated fats, found in foods such as red meat, butter, and full-fat dairy products, can increase the amount of fat stored in the liver and worsen fatty liver. 3. Trans fats. Trans fats, found in many processed foods, fried foods, and baked foods, can also increase the amount of fat stored in the liver and worsen fatty liver. 4. Added sugars. Foods and drinks that are high in added sugars, such as soda, candy, and baked goods, can lead to insulin resistance and increase the risk of developing fatty liver. 5. Salt. Consuming too much salt can increase fluid retention and worsen liver damage. 6. Processed and fried foods. Processed and fried foods are often high in unhealthy fats, added sugars, and salt, which can worsen fatty liver. Foods to eat. Here are some specific foods to include in your diet. Fruits and vegetables. Fruits and vegetables are rich in antioxidants, vitamins, and minerals that can help reduce inflammation and improve liver health. Aim for a variety of colorful fruits and vegetables, including leafy greens, berries, citrus fruits, and cruciferous vegetables such as broccoli and cauliflower. Whole grains. Whole grains, such as brown rice, quinoa, and whole wheat bread, can help improve insulin sensitivity and reduce inflammation. Lean protein sources. Choose lean protein sources such as fish, chicken, turkey, tofu, and legumes. These can help promote weight loss and reduce inflammation. Healthy fats. Include healthy fats in your diet, such as those found in nuts, seeds, avocados, and fatty fish like salmon. These can help reduce inflammation and improve liver function. Green tea. Drinking green tea may help improve liver function and reduce inflammation. Spices. Certain spices, such as turmeric and cinnamon, have anti-inflammatory properties that can help improve liver health. Exercise to cure fatty liver. Regular exercise can be beneficial in improving liver health and treating fatty liver. Exercise can help reduce inflammation, improve insulin sensitivity, and promote weight loss, which can all help reduce the amount of fat stored in the liver. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, cycling, or swimming, on most days of the week. If you're new to exercise, start slowly and gradually increase the intensity and duration of your workouts over time. Strength training exercises, such as lifting weights or doing bodyweight exercises, can also be beneficial in improving liver health. These types of exercises can help build muscle mass, which can help improve insulin sensitivity and reduce inflammation. Yoga to cure fatty liver. While there is limited research on the specific effects of yoga on fatty liver, regular yoga practice may have benefits for improving liver health and reducing inflammation. Yoga can help reduce stress, improve flexibility, and promote relaxation, which can all be beneficial for improving overall health and reducing inflammation. Stress reduction can also help improve insulin sensitivity, which can help reduce the amount of fat stored in the liver. Some specific yoga poses that may be beneficial for improving liver health include: 1. Ardha Matsyendrasana, half Lord of the Fishes pose. This seated twist can help stimulate the liver and improve digestion. 2. Bhujangasana, Cobra pose. This back bend can help improve blood flow to the liver and improve liver function. 3. Trikonasana, triangle pose. This standing pose can help improve digestion and reduce inflammation in the liver. 4. Adho Mukha Svanasana, downward facing dog pose. This pose can help improve blood flow to the liver and promote relaxation. If you have been diagnosed with fatty liver, it's important to work with a healthcare professional to develop a treatment plan that is right for you.